January 18th, which is my 81st birthday, I was out walking with my wife, and I noticed I was having a hard time walking. I couldn't quite keep straight, and I found that I was having difficulty talking properly. We decided it might be something really serious, so we had our son take me over to the ER.
Stan went through a crisis. He had a medical emergency. He had a stroke. So he went to the emergency room by ambulance. He spent some time in the hospital. And then after he got here, it was pretty apparent that this medical crisis had thrown the family into a crisis too. So it helped to have the interaction of the team here.
That team is right inside Stan Dawson's primary care doctor's office. It's home to one of Sutter Health's most transformational healthcare approaches called the patient-centered medical home. In addition to the doctor and medical assistants, there's also a case manager, triage nurse, social worker, and a pharmacist, all in the same office.
I've initially spoken with the patient to identify some issues and provide education, so the doctor is then able to work on the issues more efficiently.
The patient comes in and they get the benefit of having all these different skills available to them, sometimes the same day.
Stan's stroke was mild, but it seriously impacted his health, leaving him pre-diabetic with high blood pressure and weakness on his left side. But that didn't faze the patient-centered medical home team.
The fact that we got his blood pressure under control right away, I think, is very important, because he may have had another stroke if we didn't do that. Maureen, the pharmacist, was here to help me get control of his blood pressure. As far as being a risk for stroke, I think it's no longer a risk factor for you. With Dr. Maureen's help, we've gotten rid of that.
For a patient with diabetes and just out of a stroke and high blood pressure, he didn't quite have everything he needed.
I got a 108/48. We need to talk to him about lowering that dose.
He's got a wife who's got diabetes and is blind, and then to tell him that, oh, you have diabetes too. That was a very scary thing.
We worked on his mood a little bit too. As a doctor, my primary motivation and the thing that I care about the most is the health of my patients.
The coordinated care delivered by the patient-centered medical home team changed Stan's life.
Well, I was just really very, very pleased at the idea right from the start, especially when they said case manager, like somebody you could actually get a hold of quickly.
Right after Stan was released from the hospital, his case manager called him.
I love being able to be there for the patient proactively. He had mentioned that physical therapy was discussed, but we found never ordered, so we worked on that. And then we had the discussion about treating hypertension.
It felt very good to have this extra support.
Stan's doing great now. His strength is coming back with the physical therapy. His blood pressure has been eliminated as a risk factor. I'm very happy with the outcome, and I think Stan is too.
Well, I feel good. I don't think anybody could notice that I had any deficits from the stroke, and I feel that mostly I can't feel any deficits.
That's what the patient-centered medical home is all about. It's getting everybody involved, whether it comes from the doctor, the medical assistant, the pharmacist, the social worker, or the care manager. We're all working together, and it's great to be involved as part of the team